Welcome to this online session on ophthalmology from Joint Center International Eye Center. I'm Dr. Wang. Today we will focus on the topic of amblyopia. If a patient presents with low vision, even corrected, but we cannot find sufficient organic eye or brain disorder to explain the vision, what should we consider? Yes, dysfunction of central visual pathways. The visual pathway is a plastic system that continues to develop during childhood until around 6 to 9 years of age and is dependent on normal postnatal visual experience. Any visual problem during this critical period can mess up the establishment of normal vision, resulting in permanent visual loss that can be fixed by any corrective means when they are older. This phenomenon is called amblyopia, or lazy eye. In clinical practice, amblyopia is classified according to the causes. The four main causes are visual deprivation such as congenital cataract and ptosis, strabismus, unequal refractive error, and high degree of refractive error. Often, more than one etiology is present. These abnormalities may cause developmental defects of visual processing in the central visual pathway. The patient shows poor corrective vision, but remember, the so-called normal vision varies with age. We should not always gauge visual acuity according to the adult's reference range. Some patients use parts of the retina other than fovea to fix on the objects. We can also find cloud phenomenon where the patient feels easier to recognize one isolated optotype than archetypes arranged in rows even with the same size. Once amblyopia is confirmed, it can be grade from mild to severe based on the best corrective visual acuity. If not detected and treated early in life, amblyopia can cause permanent loss of vision with associated loss of stereopathies. The mechanism is easy to understand. If you don't use an eye, the nerve fibers of that eye won't develop. This may be explained by lack of use because of reflective components opacity or extreme refractive errors that cause a chronic blurred image inadequate to stimulate visual development. However, amblyopia in strabismus, an unilateral or asymmetric disorder, is also the result of abnormal binocular interaction. In fact, the eyes are in competition with each other. The afferent nerve connections of the strong eye proliferate while those in weak eye atrophy and dwindle. Fortunately, all of these conditions are treatable if detected early in life, and if the patient is compliant with the treatment recommendation. Age is critical for treatment. Improvements are possible at any age, but early detection and intervention offer the best outcome. Though this regrowth potential decreases with age, recent studies show that some forms of amblyopia may be successfully treated in older children. Management of amblyopia initially involves appropriate corrections of refractive error and getting rid of form deprivation, such as removal of cataract and rectification of ptosis. For asymmetric cases in which the weak eye is suppressed, we should occlude the strong eye to give the weak eye a competitive advantage and time to regrow its afferent nerve connections. Besides occlusion therapy by patching the strong eye several hours a day, penalization with drugs and or spectacles of the strong eye is another option, especially for children intolerant of occlusion therapy. Other forms of treatment include game therapy and after-image therapy. Active visual training of the embryonic eye is commonly encouraged to stimulate the visual development. Tasks such as threading beads and connecting dots, engaging in video games, or visual stimulator are useful. No matter what therapy is instituted, visual acuity of both eyes must be monitored. In summary, amblyopia is decreasing vision in an eye because of disuse of the eye during visual development. Early intervention can help the patient to achieve meaningful improvement of visual function. So here are the references. Thank you very much for joining us.